You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. This is an episode of joy for me because I have two guests who have been guests at Parallax before. One has been, a mentor and a dear friend, and has had a lot of success with prior Parallax episodes that he's been on. I'm sure his name needs no introduction. Dr. Srihari Naidu is professor of medicine at New York Medical College. He's an interventional cardiologist extraordinaire. He's intimately involved with Society for Cardiovascular Angiography and Interventions. He is on the guidelines. He's on X. He is on the podcasts. He is on news channels, and he has now written a book. He has written guideline statements as well. So that's my first guest. And then my second guest is Lindsay Davis. She actually was one of the first Parallax guests who came on board as a patient advocate. She is another extraordinary person who used her condition as purpose, is how I'd like to frame it. And she's worked with the World Heart Federation now. She is a patient advocate. She has a law in her name in the state of Ohio. She's former Miss Ohio. She keeps doing great things, and now she's come up with a book. So the two of them have collaborated to come up with a children's book on a condition which is an inherited cardiomyopathy. It's called hypertrophic cardiomyopathy, and we have them both to talk to us about their new endeavors. So with that introduction, Dr. Srihari Naidu and Lindsay, welcome to Parallax. Welcome again, and thank you so much for doing this for us.
Thank you for having us, and thank you for doing this. I think it's very helpful to raise awareness. And since this is a unique concept of what we did together, I think it's important for people to hear how we did it, why we did it, and think outside the box a little bit. So thank you again for having us.
Yeah, no, certainly it's my pleasure. Thanks again for being here. So I'm going to start, Lindsay, by asking you, tell us about when you thought that you should write a book on hypertrophic cardiomyopathy, and from a perspective of a patient. I'm assuming I haven't had a chance to get a copy, although I've read several of the reviews our colleagues have posted online. But I'll have you go through the process, and that too. Part two to the question is not only a book from a patient's perspective, but sort of writing a children's book. So tell us about that.
Well, first of all, thank you so much for having us on today and for seeing a need for this book and for the awareness. I'm just really grateful for all your support through the years. So thank you. A little bit about my story. I was a ballerina my entire life, and I was planning on going to Juilliard. And I started having all these symptoms, and all of the people around me were not really aware that I could be concealing a heart condition. And it wasn't until a collapse that I was taken to the Cleveland Clinic, and I was diagnosed with hypertrophic cardiomyopathy. Following that initial diagnosis, my first question was, how do you even say hypertrophowatsky? And I was just really scared in that time in the hospital. I didn't understand why I had to take new medications, why I had to follow this treatment path in which I couldn't dance anymore. At the time, that was commonly accepted in HCM. We know now that exercise is actually good for the heart. But I was also really scared about all these tests that were happening to me. I didn't understand what they meant. I didn't understand how they helped the doctor. And since then, I've learned a lot about those tests. I've learned a lot about my condition. And I felt the more that I learned, the more I was comfortable. I was feeling better about the condition. I was better able to have conversations with my doctors, and I was getting better care because of that. So for the longest time, I've wanted to create something in which I could help educate children like I was and their families on the condition. I wanted to give them the same experience that I had in finding comfort in knowledge and how to be a better patient, how to interact with their doctor, and how to understand the condition.
Yeah, no, that's fascinating. The process of putting your pain to purpose is a noble one, and you certainly have demonstrated through this effort that's what you have aspired to do here. Dr. Naidu, you're an expert in hypertrophic cardiomyopathy. You have a book published, which is coming up with a new edition now. You've been on the guidelines. This would be sort of like a Parallax experience for you, writing a children's book from a patient's perspective. And I sort of pun is intended here, because it's sort of looking at the same condition from another angle, which is what Parallax means. So tell us about how you felt as an author, knowing the expert that you are in the disease condition. How did you feel now putting this together from a patient's perspective with a patient as an author?
Yeah, this is exactly as you mentioned, which is looking at the same problem from a different angle. And I think that is the crux of this, which is that as a physician, we're trained our whole lives to educate and be the one, the caregiver and the treater, the healer. But we learn it from that angle of what is the disease, how do you diagnose it, how do you treat it, and we try to educate our patients that way. And we go our whole lives educating each other on how to be more effective as physicians, not really realizing that the biggest gap in care is not how we treat a patient or the mistakes that we make or the successes that we have, but rather who we see. And we probably see an infinitesimally small percentage of the patients that we could potentially help. And especially for a genetic disease that starts younger, it's most important to raise awareness and get those people into our doors, into our centers of excellence. We can be as good as we can be, but we can only help the person in front of us. So I realized fairly recently that I need to shift gears and find a way to sort of wrap my arms around the problem in a much larger way than what's right coming through my door. And I guess it's also tied into the fact that I'm a father, and obviously I read a lot of children's books to my son as he grew up. And I understand that that's a fascinating and a very memorable experience for both parent and child. And it makes a big impact on them. And so it can be very soothing, that nice environment of your home and your family with loved ones to learn about something in a way that is not scary. And I think that the third part of this is that of all the things that I've done for patients, the biggest thing I struggle with is protecting the rest of their family. And that's because in our country in particular, when you treat a patient with something, they're very private about it, even within their own family. They don't go tell their brothers, sisters, their kids, their parents about their problem or their disease. And that's a very American thing, which I don't think is actually quite good, because it doesn't provide the opportunity for the rest of the family to learn and to protect themselves and to try to prevent and change behavior so that they can learn from those problems and prevent a lot of the downstream consequences of those diseases. So I want to provide a tool for them to take home, which they don't have to be the expert with their family. The book can do that and provide an introduction that's not scary, that tells people to come to the hospital, to the office. And in particular, since HCM starts in puberty or later, a book that allows you to read it to them at an earlier age so that they are introduced to the disease and not scared because they don't even know if they're going to get it or have it. That's probably the ideal time to be introduced to something that you might get later on. And I give the example where I go of other cancers, such as breast cancer, where, if a mother has that, they don't hide it from the rest of their family. They tell their kids. If there were a book that they could read to their child about what they're going through and how to prevent that, I think that'd be very important and very well regarded and well received. And so the concept for me was to have that tool for the rest of the family to address all the things I just mentioned. But I'll end this comment on the fact that even though I did all that from my angle, I still kind of it didn't hit me how much this can interact with kids. And I shared with Lindsay a video that I got from somebody who bought the book, and their daughter was running around reading the book and holding the book and having everybody read it to her because she's too young to read it herself. And it struck me that this can also be something that a child loves, the characters, the story, and they're learning at the same time. And so the power of a tool for kids, like a children's book, it didn't really hit me still until last night. And so I think for all those reasons, I've been very happy about it.
Yeah, no, thanks for sharing that with us. I mean, certainly I think, children are so pure, energetically and spiritually. They are such pure beings that if you can do something to enhance their lives, and if you can touch their lives in ways which makes them feel cared for and special, to me, and being a father myself, I think that's like one of the most noble things you can do as a human. So thank you for sharing that anecdote with us, and thank you for putting this book together. Both to you and to Lindsay. Lindsay, I'm going to ask you the next question. I'm going to sort of delve into a little bit of the technicalities and the nuances of putting this book together. Where did you start? Like, in terms of when you started writing the book, did you always think that this will be an illustrative children's book the way it is now? You want to go through the process with us a little bit?
Sure. I mean, I definitely knew that it needed to be illustrated. I knew that it needed to be colorful. For the longest time, I was volunteering at children's hospitals. I kind of understand how children learn. They learn through play. They learn through stories. And a lot of the way that we explain things, like, yes, it's for a child. It can also be kind of a beginner level adult explanation. But some of the ways that we explain things, like a blood pressure cuff is a hug for your arm. That's a way that a child would understand that. We were also really adamant on finding a really good artist. I think Dr. Naidu can speak more to this because he's very into his comic book art and was very particular in our artists. I did do a big search for an artist. I found, I think we had like 80 of them that I found or something. And I put together Excel sheets of their art and a little bit about their stories as well. A lot of the artists were sending me stories of their connections to heart disease or their connections to children and educating children. So it was very deeply personal for a lot of people that wanted to be a part of this project. But we inevitably did find an amazing artist. She's Hungarian. She's in Scotland now. Her name is Rika Kadar. And she had a really big passion for educating children. And we were so lucky to connect with her. And I think that her art really takes the book to the next level. Dr. Naidu and I had this passion for educating on this cardiovascular cause, but she just really her art shines through. So we were really excited to be working with her on it.
Yeah, I will say that, a children's book is basically a graphic novel. So for me, having a big collection in comic art, I understand as an adult that graphic illustrations can hit you in a different way because that the image is also imprinted on your brain. And I think for a child, they have more trouble visualizing what might happen or what they have to do. And so the visual aspect of seeing blood being taken, seeing an EKG being done, seeing what a telemetry box is, seeing what an echo is. I know you haven't seen the book yet, but we go through images that are very purposeful that show exactly what the experience would be like, even being wheeled down the hallway of a hospital in a wheelchair. These types of things will make all those experiences less scary. And Lindsay is correct in that she did an amazing, we're a good partnership because we have different skills. The best partnerships are people who have similar passion, but different skill sets. And so we have very similar passion for this disease in different ways, in parallax ways. But we have very different skill sets. And so things that she's great at, she runs with. Things that I'm great at, I run with. And even with the publicity and marketing, we don't always have to be on the calls together. We understand that the whole is better than more than the sum of the parts. But I think when we looked at the art, we looked at different artists, and I was very cognizant that if the main character is a female, I want to make sure the book can relate to all different types of people. And so the images had to be demographically diverse, had to be different types of caretakers, had to kind of make things not just the way things are visualized for people, but what it could be in the future for people. So it can relate to a lot of people. And even when we chose different artists, we wanted the style to be a little bit more fantastical. So I think when you see it, more bold and more fantastical in that, kind of deep and dark reds and blues and kind of swooshes. And so it looks like it's a drapery of art. And I think the art in the book is one of the most engaging aspects. Everything has to be perfect. The story has to be the right size. The story has to be at a level that is comprehensible to all. The story has to be diverse. It has to make points that weave in all the educational content that we want. And it has to be cute and memorable. And I think we spent a lot of time. This took about 3 years, 4 years from the concept, 3 years of actual work, and all on the side. And we really didn't tell anybody because, all along the way, we didn't know what was going to happen. I mean, we're just kind of going along and learning as we go. But going back to the art, we are very grateful for Rekha. She did this. And it took a while, as any great project does, but we were very happy signing off on each of these pages and very happy with this product. And as you can see, once people get it in their hands, they're really impressed by the total package.
And I think one more note on the color that you were kind of touching on, the red and the blue. We also worked with a child psychologist, and some of the imagery, like when the character is scared and doesn't understand what's going on, these are very small nuances in the art, but the background will be red, which is kind of scary and alarming. And you notice as the book continues on, the colors start to shift to things that are more like blues, things that are much more soothing.
Lighter pink comes in more.
Yeah.
Right.
Yeah. So there's just these little nuances in the psychology kind of in the background. Everything is just really well thought out between the medicine, the psychology, the terminology, and the art. It's just, I think it all marries together really well and really beautifully.
It certainly sounds very fascinating and eclectic. Let me ask you something, and maybe Dr. Naidu, you can go in first on this. As an author of an illustrative children's book, and also someone who intimately knows the disease from a scientific, clinical standpoint, what was the most challenging aspect for you as an author?
I think the challenging thing as an author is the same thing that's challenging for any physician. How to distill a complex disease into its skeleton. What do you really need to know that gives you a good framework for the disease? And by the time you put the book down and turn it over to the back cover, you're 90% of the way there. And so I think that was the most challenging part. If you're going to have an enduring content, it has to be perfect in that way and not leave open-ended questions that people come away that they don't fully understand that first step into the disease process or how to take care of it. So I think, I'm not sure that answers your question, but I think we spent a lot of time making sure that we don't have any regrets at the end that we should have done this, I should have done that. And honestly, we don't have much. I can't think of much or any, to be honest, that we didn't really cover. And I think maybe that's because it took a while that we were able to go back and forth multiple times to add in little details here and there. There's lots of little Easter eggs in this thing as well. As you know, my son is in there. And so, his favorite teddy bear is in there. If you look for it, his favorite blankie is in there at that age. We don't mention it, but it's all there. And there's lots of little things like Lindsay's parents and how they look back in that time that made it very personal. But going back to your question, as an author of the science aspect, it was very important for me to have everything be very accurate, all the way down to the details. Even the EKG strips that are there for decorative purposes on the corners are actually LVH with Weepole. And it's obvious to a cardiologist, but not obvious to a patient necessarily. And the echo image that you see is actually, you'll see it when you get the book, is an echo with a asymmetric hypertrophy and an obvious anterior leaflet SAM. So I think for all these reasons, it was important to have that scientific background, because I think if a doctor does it alone without a patient, we are missing a lot of the empathy and all the things that Lindsay mentioned in terms of the psychology of it and how to cope with these things. And if a patient does it without an expert, you're going to miss all these details that makes it accurate. So this pairing allowed us to, ultimately optimize it for all audiences, because there will be very little critique about how it approaches the patient or how it approaches the educator.
Fascinating answer, and I pray that this sort of becomes the springboard for other such collaborations to occur between patients and their physicians. Lindsay, what do you think was the most challenging aspect for you as an author here when putting this together?
Honestly, it was such an amazing project to work on. I don't think there was actually any difficulties. The only difficult thing for me is I was just so excited. Like, as we were doing it, I was like, this is amazing. I absolutely love this. I can't wait to share this with the world. So I think the only difficult thing was that it took so long to do. But we wanted to do it right. And we wanted to kind of keep it kind of secret for as long as we could, and then share it with the world and hope that it really benefits children and their families. So honestly, that's probably the only difficult thing for me, that I was just so excited and I wanted to share it with all of the families that I speak to constantly.
Yeah, Ankur, there is a cadence to this in that everything takes a while. I mean, the concept of writing the actual script, figuring out how many words is a children's book, how many pages is, how many words can you have in a page without it getting boring or repetitive, how to match the words to pictures, what images make sense, then approving all the art one by one, which takes about a year. Artists they work on a page a day, maybe a page a week, really. It takes a while. And then figuring out if you want to do independent versus hybrid versus traditional publishing, there's all these different benefits and risks to each of them. Traditional means you lose all your rights and the copyright. Totally independent usually means that Amazon owns all of that. And so we went the middle ground where we completely own the copyrights with a hybrid publisher, but they still get us into all the digital venues and help us with the initial marketing and some of their contacts. But it does mean that we could take it and go somewhere else and republish it. It means we have full authority on the characters. We don't have to get permission to use those characters for anything else. And so it opens up the door for us to do sequels and translate the book and all these things. So all that process took a while. And then even once it's approved and publishing, there's like a 3 to 4 month queue of all the different books that are coming through the publisher to when we actually get published. And during that time, we're trying to market it. So it's a long process. And I would encourage anybody who wants to learn about this, they can certainly reach out to either one of us, because we learned about it on our own. And it was a fun process, but it's a very difficult process.
Yes, no. What I was going to say was that I resonate with what Lindsay shared, that, when you are putting something exciting together, you just want to share it. And I think the discipline to keep this secret, which I think I could not master with my poetry book when I came out with it. I started to advertising it like a year before it actually even came out. Was hard. And I think to your point on how involved the process is, I mean, I learned a lot of what you just mentioned, through trial and error. What form of publishing, and the multiple ways that you can go about it. And then there's an entire process of manuscript review, editing, then putting it together in a page format, then looking at all those page proofs and looking at the numbers and the content and the forward, and when it releases, the ISBN. I mean, there's so many processes to this process, so many steps to this process that you actually end up learning. It's a project in and of itself, as I'm sure you both appreciate now. But no, I mean, from one author to new authors, congratulations. And I wish I pray and I wish that you come up with a sequel and that these characters become household names, I would even venture out to say that, maybe you can inspire Disney to come up with a movie. Wouldn't that be fascinating?
Oh, wow. Yeah.
That would be amazing.
We do have lots of plans of getting this on Sesame Street and other things like that, because I don't know, you haven't seen it yet, but we got some major endorsements on the back. Two of whom I got, which were names you'd recognize. We got Brunwald and Dr. Fuster to both write something for the back cover. And then Lindsay got, Lindsay, you can tell us a little bit about who you got to endorse, but we're hoping these people will help us move into different directions, because a book has to be more mainstream than what we're used to.
Yes, no, I mean, just to your comment there, I mean, I think we could have asked for bigger names than Doctors Braunwald and Fuster in Cardiology to endorse a book. Lindsay, who did you find for endorsements of this work?
So I had Denzel Ward, who plays in the NFL, and he has an organization called Make Them Know Your Name. And he works very close with his mother, Nicole Ward, who's a close friend of mine. And they have a really sad story about Denzel lost his father and Nicole lost her husband to sudden cardiac arrest. And they're really big advocates in the cardiovascular space for learning CPR and having AEDs. And I also had John White, who's the chief medical officer at WebMD, and who's just absolutely amazing with spreading awareness for HCM and the psychological impact of HCM. And he's just been a really big support through this all. So we're really grateful to have him endorse it as well.
Well, excellent. Sounds like these are, fascinating and top-notch endorsements. You are now in the most exciting phase of publishing, I would say, which is, getting out there and sort of advertising, your product, and, trying to get your book to as many homes and families and hands as possible. What is the most exciting incident you would like to share with us when it comes to post production or marketing that you've experienced so far?
Just for me, I speak to so many HCM patients, and kind of when this book was available for pre-order on Amazon, I put it on my social media, and I have a lot of patients that follow me, and everyone started buying the book and telling me, hey, I just bought this, I bought this. And on August 20th, when the book came out, Amazon had shipped the book to everyone. And just reading these messages from the patients that I interact with, telling me about how they shared it with their child, or how now it's easier to explain it to their parents, and how it was just much more digestible in a way to help anyone, not even children, understand HCM and the treatments. It just meant a lot. It showed me that the purpose of this book, that the book was fulfilling its purpose. It was educating, and it was helping people become more comfortable with their diagnosis and know that everything was going to be okay, and know that just that it'd be a helpful tool to educate the people around them, their families. So that, I think that so far has been the biggest moment for me. It's only been out a couple days, and it only had a couple days for people to kind of digest it, but that's been so exciting for me. And I've just been really, really thrilled with that response so far.
Yeah, same thing here. Having texts from all my friends and colleagues and other people who bought the book. And it was very clear then that they bought it a while back. And because if you buy it now, it's going to take a week to come on Amazon. They sold out quickly, and now they ordered more. But the people who got it in the first few days, those are the true loyal people who really want to support. And so all those people were sending me texts with the picture of the book and with a huge smile on their face. And so I was very proud of that, because it means that, at least personally, that Lindsay and I have a lot of people who really are proud of what we're doing and understand the mission of what we're doing and why we did it, and understand our passion. And then, as I mentioned, the video of the girl walking around, at the end of the day, it has to resonate with the target audience, and in this case, is kids. And so I want to make sure that they pick it up and they really love the characters, Lindsay and Karen, as the two central characters, and that means a lot to me as well. And I think the biggest media thing so far has been the NBC News, and Lindsay and I had the opportunity to be on NBC News twice on our launch day, which I think makes it very memorable. It was a parenting episode, and we got to speak in 2 4-minute clips with some amazing anchors about the book and why we did it, and truthfully raise awareness on a national level. NBC is about as big as you can get on sudden cardiac arrest prevention, and not just sudden cardiac arrest in the news, which is what we typically hear. And I reflected on that in that I've been working on HCM, and you've also been working on HCM, Ankur, for I've been doing 20 years, you probably at least 10 years. And I don't think we're going to ever make as much of a difference in HCM as we can by spreading the word on national media. All the stuff we do, I mean, in that 1 segment or 2 segments, people heard about it and understood it way more than all the shouting we did from our trade journals and conferences. And so that impact was very important to me. And, I think that we as physicians should stay in our lane. And if we're going to be in the news media, make sure that we are authentic and stay to our expertise. But when those all coalesce like this, it's a wonderful thing.
Yeah, no, absolutely. And, I'm talking about your target audience. I have 2 boys, and I think so far they're young. They're 7 and 5, and the younger one wants to be a cardiologist, and they're in India doing their school year, and I'm going to be visiting them for Diwali, and I plan to give them each a copy of this book. So I'm going to let you know from my home what the feedback is. At the end of the day, it's a children's book. So I think for a cardiologist dad who's interested in HCM and who has done some work in hypertrophic cardiomyopathy, I think would be fascinating way for me to sort of plant that seed and then them both to pursue cardiology as a career. Talking about Asian parenting and Asian dads. Dr. Naidu, you had, so again, fascinating conversation. Is there anything else?
Well, your kids may just all of a sudden realize what you do. This might be their first real visualization of what dad does. And you might be fascinated by that. I'm curious to hear what they say after they read it with you as a father.
Yeah. No, I think as soon as I'm done with this episode, I'm going to go on Amazon and order two copies so that they can arrive in time for me to be able to take them with me when I travel. What I was asking you was, Dr. Naidu and also Lindsay, is there anything you think we haven't covered during this conversation, which has been a very joyful and a fascinating conversation about your book? And from on the behalf of Parallax, and congratulations once again for putting this together for our most cherished component of the society. Anything you think we haven't covered?
The only thing we haven't covered that we want to get out there is that, we're not done. We want to spread the word, globally. This is coming out in the US. We want to make sure that since this is a disease that affects everybody in the world, and it probably affects, in terms of outcomes, people who don't have the means or the healthcare system to approach in other countries. So for us, it's very important to get the word out. And so I think in our next, year or so, we'd like to translate it to multiple languages so that people can at least get an introduction to HCM all over the place and start planting a seed of how they want to take care of this. And we have lots of other ideas. And you mentioned the sequel. It's possible to have a sequel maybe in a few years. The whole adventures of Lindsay and Karen as it relates to healthcare and these types of things. I think we want to just make sure people are aware that we're not just focusing here. A disease in healthcare is global, and we want to make sure that the book relates to them.
And I'm so excited to hear that you're going to share this with your children. That just makes me so happy. We also do have another component of the book. We have toys because children not only learn through stories, but they learn through play. And we did a collaboration with an amazing woman named Mary Jenner at the Butterfly Pig. And we have every test that's in the book. there's a toy version. There's a toy echo, a toy EKG. We have little ICDs that you can sew onto your teddy bear. And there's even a ballerina pink one, like a special edition for Lindsay's Big Heart book. So we're really excited to have that as well. So we are kind of touching on every aspect and corner of how you educate a child and how you kind of introduce them to this disease and how they understand. We're meeting them at the best level that we can to kind of educate and
Yeah, Ankur, these toys are amazing. They're 3D printed and they're small. They're probably like 2 inches by 3 inches or smaller, but they're it looks like an actual echo machine. It looks like an actual EKG machine. It looks like an actual ICD. And so for younger kids who want to be tactile, we're planning to put a little pouch together with a drawstring or something like that with these little toys in it, where people could buy those so that they can play with these things before they get these tests or in the hospital. And we do have plans to partner with hospitals. We may get grants. We may find donors who want to supply funding so we can get this out there to kids, when they're in the hospital. So we're thinking pretty broad. Obviously the book has to do well on its own, but I think, everything needs a push, and the more you can do and synergize that, I think thinking outside the box is helpful.
Oh, no, I couldn't agree more. I think it's to get the merchandise, to get onto the merch bandwagon and have that be, widely available and popular, so that actually draws the audience back to the book, I think is a fascinating idea. And I think both components may feed off of each other, which is fantastic. And so, I'm just putting a seed out there to the universe that someday we'll see a Disney movie. So, here we go. We planted the seed on Friday, August 23rd. Any closing remarks from both of you, Dr. Naidu and Lindsay? Any closing remarks?
I just want to say thank you, Ankur. You've been a support, and I think you're great at thinking outside the box on what kinds of topics make sense for your listeners. And I think there's lots of people here. It's an important disease to get the word out. It's to get the book out there, but it's also important. You have a lot of healthcare people and doctors listening. I think I everything I do in my life, I understand that people are watching what I do, and that it should be emblematic of how to behave or how to think, maybe, and inspire others. So I think you jumping on these, as you've done with Shelley and other people with their books, I think is really not just supportive, but helpful to the rest of the community.
I'm always so grateful for all the help you provide and how you see the importance of the patient voice in these conversations and shared decision making. So I'm really grateful for you highlighting that and highlighting this book that's co-written by a patient. Just really grateful for all your support through the years.
Oh, no, it's my pleasure. So thank you again for both being here. For our listenership, thanks again for tuning in. Like always, send us your comments, questions, feedback at the email, which is listed in the show notes. We'll make sure that we are providing a link to the Amazon bookstore where you can purchase this book. If you have any comments that you want to share with Dr. Naidu or Lindsay, you can write us back and we will be sure to forward it to them, or you can write to them directly, as they've said. Do share your feedback with us. It's crucial that you share your feedback with us. We take it seriously. Rate us and review us on Apple Podcasts, SoundCloud, and Spotify. And until other Monday, thank you for listening.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.